Hi everyone, welcome to my Taylor Talk. We have started a simulation program for the NICU that's newish, and so if we haven't seen you in person yet this month, sorry, but we're working on it. In the meantime, we're creating some digital content so that you guys can get the information at your fingertips whenever you need it. So feel free to save this video and teach future orientees or watch it at your leisure. This month's topic is developmental positioning, and I'm going to run through a few scenarios. And if you have any questions following, you're not obviously going to be able to ask me right now, but please email me if you think of something that you want to ask or clarify. I'm going to kind of hobble with my boot behind my little stand here. Okay, so I've laid out kind of our developmental positioning products, and I'm going to read some scenarios and give a little beat so you can think of the answer, and then I'll kind of do some hands-on. So scenario one, we have a 23-weeker who is 500 grams in humidity, day of age 1 on the IVH bundle. This baby is intubated on the jet with a UVC and a UAC. What position will you avoid placing this patient in and why? So the answer is prone. You're not going to put this baby prone. 2 reasons. One, they've got umbilical lines, so you don't want to not be able to visualize those lines, risk them coming out bleeding. And the second is the IVH bundle. So cerebral blood flow is very dependent on being midline. And to be prone, the baby's going to have their head turned one way or the other, and that can affect their cerebral blood flow and increase their IVH risk. So the goal is to keep midline at all times, whether that's supine or log rolled to the side, as long as their body and head are facing the same direction. So the next scenario is to position this baby supine while in phototherapy. So this baby is really tiny. We have 3 sizes of this, a tinier one and a bigger one. This is called a Wombi pod. It is kind of like a little baby straitjacket that's mesh and has like 96% lucency. So most of that phototherapy light is getting to the baby. If you find that your providers are asking you to take them out of this because they're not getting enough light, you can assure them that they're only missing out on like 3 to 4% of those rays. So this does have a 2-way zipper, which is really handy. So that way you can unzip it from the bottom portion and still visualize your umbilical lines and have those free, but have the arms contained. So this is going to be our little 23-weeker. He's a little large and a little floppy, but you can kind of just place him in the Wombi pod. He's not the correct size for kind of any of these products, so you're going to have to do your best to appropriately size. But this allows them to have some containment while they're getting phototherapy. So supine, this baby is really small. We've got these products back in. These are called snuggle ups. We have 2 different sizes of snuggle ups. Smaller, larger. One's actually like a small, one's a medium. But for this baby, we're going to use the small snuggle up. And it works a little different than the Dandle 2 in that it doesn't have a swaddling capability. So while this baby's on phototherapy, you do want to maximize skin contact with the light. And so you will place this baby feet into this little barrier. And then these straps, you're not really going to use that much on phototherapy, but you can kind of create over the diaper area, since that's covered anyway, a little strap there, and maybe combine the second strap over there. And then you're welcome to utilize the bean bags for that 360-degree barrier. Babies want kind of 360 degrees of proprioception, so like they're in the womb and feeling their walls. Just make sure you're not laying the beanbag on top of the baby's chest in any capacity, because it's heavy and can impede their respirations. But as long as they're kind of tucked in 360 degrees, you can use, either size. We have 2 sizes of these, depending on what size your baby is. For our littlest babies, you do not want to use the Dandle 2s, and I'll explain that in the next scenario. So your baby no longer needs phototherapy. You can take them out of this Wombi pod, and you can still use the snuggle up. So their feet can get against here. Now you can use the straps. So you still want to visualize their stuff. So make sure that you're kind of containing their arms in kind of a flexed position. So if you're worried about them pulling stuff out, maybe you lower that flexed position or lower it or lower it. Try not to straight jacket arms down. It's not developmentally appropriate. So the more flexion, the better. So I'm gonna use the horizontal strapping You can also use a crisscross technique, whatever you feel like contains your baby the best. And same thing, you can use the bean bags for that 360 degrees of proprioception. Okay, gel pillows. We have a squish on 3. It is very filled, so we are not going to want to use this for our smallest babies. This is only to be used in side-lying position, which I think is new information for a lot of you. It is so that you are not getting that toaster head, townhouse head on the babies as they form their cranial formation. So when they're side-lying on the littlest babies, it kind of causes them to like crank their heads up. So just try to avoid it. We're looking into smaller gel pillows that are circular, that have less fill for our tiniest babies, so that we can do some pressure relief when they're side-lying. The only time you would use this supine is if the baby has a really, really flat head and you've kind of talked about it with PT, OT, the team, or if they've got some condition that needs some pressure relief back there, a sore or some congenital anomaly. But otherwise, please reserve this only for side-lying position. It is a pressure relief device for side-lying. If your baby's in the incubator, it does need to be warmed up a little bit. So just kind of hold it out in the corner of one of your incubator corners to warm while your baby's supine or prone, and then reserve it nice and warm for when they're side-lying. The most important thing is when your baby has lines is to make sure that you're able to visualize those on the regular, at least every hour. So not covering up lines, and also they're going to be on skin control in the incubator at this weight and age. So not covering up that temp probe with a bean bag or a strap, doing your best to kind of have that open. But you know, their body surface area is really small, so sometimes that's a little more difficult. But again, make sure that you are not placing the bean bag on top of the baby. They do have those Zacky hand kind of things that they sell. If you kind of want that, you can kind of drain some of the bean bags out and kind of rest it on like a shoulder or a hip, somewhere that the whole force of the bean bag is not in the baby, on the baby. You can also utilize these snakes, that's not the correct term, I'm so sorry, to provide that boundary around. Each of them, we have 2 different sizes, has this little special hook fabric piece, and that allows you to kind of make a whole oval with the piece instead of just a U. So if you do feel like they would benefit from that 360 degrees, that will help you kind of keep it in place. Okay. As the baby goes sideline, you want to make sure you're log rolling them and keeping them midline and flex. So just supine, they want to be kind of midline and flex, but also on their side, they also want to be midline and flex, just like they are in the womb. So that's not hands out here, not legs frogging out. And so utilizing kind of a blanket roll to help them pregnancy pillow bond around that so that they can maintain that correct positioning. So making sure they're just not collapsing or hyperextending. Sometimes their legs and hips kind of want to froggy out. This is a great time to utilize the little bean bags, whatever size you use, to kind of keep their hips in line. Something like that. Okay, next we're going to talk about the RU2. So when your baby grows a little bit and is now in that 1,200 gram range and bigger, you can utilize this RU2. If your baby's smaller, you can still use it, you just can't use it fully with the whole swaddle component. So this is made so that you're not swaddling them inappropriately. I get that the straps are a little more flimsy, so if you need to have a cloth diaper for like an extra strap of containment, that's okay. But the goal is to have this kind of stretchiness so that babies can get that resistance as they grow their bones and muscles. So the RU2 is a little bit different, whereas this is designed to be on the head part, not the feet part. And the baby can be kind of swaddled once they hit 1,200 grams. Please don't swaddle them in a cloth diaper. Please don't dress them yet. This is still, they're naked, but now they're transitioning to air control. And we do want to give them a little bit of that ability to kick and stretch against the fabric. So sometimes the fabric is a little high on the baby, so I like to kind of twist it a little so you get this V at the baby's face, and that way they're not getting suffocated by the fabric. And then this can be completely pulled up here so that they're in this little swaddle situation. Now if they're smaller, you're not going to be able to use this whole component. So you can just use the arm piece, and then careful of this Velcro here, it's a little sharp. So roll it down a little bit, and you can use it to kind of capture their feet, and then maybe grab one of the beanbag froggy guys and make their hips like that. And then if you need more space for tubing, this can be rolled down. Another way you can modify it is to kind of make it a snuggle up. So turn it completely around, and then this is gonna act like the foot zone, like the snuggle up does. And then this little headpiece is just gonna be not used. You're gonna kind of tuck it underneath. And then the straps actually fit really nicely in this position. You can also utilize another froggy or some type of blanket roll to create that 360. But you can see this mimics more of a swaddle up, snuggle up, where the foot is where this piece is. So feel free to get creative as long as you're being able to visualize the baby, their devices, and the temp probe's not covered. Okay, so scenario 2 is you've got a 36-weeker who's 2 kilograms in a bassinet with a PIV just for antibiotics and is on room air. What practice needs to be followed? Safe sleep is your answer. So safe sleep, back to sleep. No excess blankets, no positioning devices unless you have an order, and appropriately addressed. So that means no hat unless you're in that first 24 hours of weaning. Make sure that you're bundled appropriately. So we preferentially want to use these swaddle sacks, but some of them are just too big for our babies. So if you can use this, great. It allows for that stretch and movement. Otherwise, you're going to be swaddling them in our blankets. Or we do have a couple jersey knit blankets that are a little more stretchy that we're hoping to prioritize for swaddling instead of cute bed making. So if you find one of those are great swaddles, and we're hoping to get more. So you're following safe sleep. Here's our little baby. Are you allowed to prone this patient? Kind of a trick question. So yes and no. So no, you cannot prone them and walk away and go do your other baby. But tummy time is super crucial for this population to get neck strength, to help their head shape, and sometimes to help with reflux and gas. And so while you are charting maybe at your bedside and they're still kind of awake because you just finished cares, feel free to give them a little tummy time in their bassinet. And then before you walk away to go do your next patient, flip them back supine for safe sleep practices. Parents can also do prone positioning, tummy time, while they're doing care. So kangaroo care with this child, that kind of counts as tummy time because they're not getting that pressure on the back of their head and they're able to move their neck freely. Or if you're holding them in a blanket swaddle while you're charting or just comforting them, you can use it tummy time instead of just holding them like this. So those are great developmental bonuses for these babies. This baby now all of a sudden needs to go on bubble CPAP because he's having some respiratory issues. Do you still have to follow safe sleep guidelines, or can you start using positioning devices? You can start using positioning devices. So you might grab one of these guys to make sure that they have boundaries, and you don't need an order anymore because they don't qualify for safe sleep with that respiratory equipment. But once they get better, you have to remember to take it away. And it's never too late to start role modeling safe sleep for families. So teaching them about it early and often so that the day of discharge, they're not just getting an overload of information and that's something that they maybe don't clue into. You are allowed to use positioning devices like I mentioned before with an order. So if you've got a baby with plagiocephaly and they need to be positioned a certain way, the Z-Flow is a great device but does need an order. So you can kind of do this so that the baby is forced to look a certain way. What you don't need an order for is if you're just switching where the head of the bed is. So say they're always looking this way because they're little social beings, you can change the way the bassinet or crib is so that they're looking this way. You don't need an order for that. That's up to you. But if you're adding a device into their safe sleep environment, you do need an order and a rationale why. So feel free to advocate for that as you need. You can even ask for one of these to keep them on their side as well. Okay, so again, gel pillows not for supine. And then once they're out in a crib or bassinet and you don't have an order, this is chilly. So they don't really need a squish-on gel pillow unless you've got an order for like a head issue. Still make sure that you can visualize this IV for your hourly checks. So that means probably not dressing this baby in a sleeper, leaving this leg out for swaddles. Pretend this is a PIV and not a PIC also. And then encouraging families who love to look at these devices that this is just for hospital use. These are not something that you should buy aftermarket for safe sleep. Okay, last scenario. Thanks for bearing with me. Scenario number 3, you've got a 30-weeker, 1,300 grams in an isolette on bubble CPAP with an NG tube, full feeds. So positioning this patient prone. This is gonna be our patient again, floppy. You can utilize either the RU2 or you can utilize the larger Snuggle Up, but we are gonna say that Z-flows are for prone positioning. We are no longer allowing blanket rolls, it's too stiff, and gel pillows are the opposite, too fluidized, and so Goldilocks right in the middle is your Z-flow, where you can mold it how you want it, and it can help with the baby. You can also utilize this under the head for side lying for CPAP babies if you're having a hard time with the gel pillow and the posts pushing on the baby's head. So you can try to get creative and have the baby only on the corner of it, and then the post maybe sticks out. But if that's really not working, these are fabulous because you can create a tunnel for that tubing and still kind of position your baby. So you might say, well, this looks huge. My baby is super tiny. How do I do that? So there's a couple ways. You don't have to use this whole device. You can just use the bottom half. If you're using the RU2, that can become tricky because you're kind of stuck with this abutting against this and you don't have a lot of runway. So you can either fold that down and that way you have a ton of runway and that way your baby's legs can fit, or you can use it the opposite way, like we described in the other scenario where this is the foot part, and that way you have a lot of runway here. You can create something with this, you can create something with this, you can get creative. We just are asking that you do not make your own homemade nests if at all possible. We realize sometimes supplies are limited. We are ordering more of the RU2s in the size medium, but if you find that you do not have a device at all, then you make your homemade nest. But hopefully you can strategically use what we have available. So prone positioning with the Z-flow, you can either use the bottom half, so you want their hips kind of belly button line to be at the end so that they're midline and center still and in a flexed position. So I'm not using the whole top half because my baby's hips end right here and then my knees are bent under here this way. If I need to create a little tunnel for whatever here, I can do that. Other things you can do is to create a little teeny skinny one by smushing just the middle together, and you've created this middle channel here to make a smaller prone positioning device. So these are super moldable. They have no memory, so you can do it over and over again and start from scratch till you get in the right position. But you want the babies to kind of hug around it. I like to kind of push their arms, hug around it, pick whatever side seems the most comfortable and needs the most rest, and make sure they're still midline and flexed. And also making sure that they're secure and not gonna like tumble off. So again, utilizing the bean bags to provide that 360 barrier around, maybe one down there, one at the top. The last piece of developmental stuff I want to talk about is layers of blankets under baby. So the recommendation from NAN is 3 layers of blankets. So if you're using one of these folded up under a baby, that is like 1, 2, 3, 4, 5, 6, so that's already exceeded your blanket allowance. So, you know, sometimes we need a little more, but please don't layer like 7 blankets so that you can just take one off and you still have one available. Maybe like hospital blanket or the yellow fitted one for the bassinet, and then a burp cloth for under the head, and then the developmental device, that's 3. Or, you know, hospital blanket, cube blanket, developmental device, and they're naked. So try to limit that because it increases breathability the fewer layers you have for the baby's skin. And then these blankets are clearly not ironed by a professional. So all these little micro wrinkles, if there's a micro wrinkle here on this blanket and then at the bottom of another blanket, they have a lot more areas to have skin breakdown issues. So this was your first Taylor Talk. Please come back for more. Please email me with any questions you might have. And we're happy to take suggestions for future topics as well. Thanks so much, and I appreciate your time.